Okay, so we are from PenjelajahSejarah and now we are going to talk about our findings. For patient dropout analysis, why Storm and Vale Hospital most valuable patients never return. So before starting, our team brainstormed our findings. From the dataset, we can see that there are patients that only came once and never came back. Our team concluded that this is alarming in context of chronic illness, as it could get worse without any care. So what is chronic? So chronic refers to a condition, disease, or habit that is long-lasting, persistent, or recurs frequently over an extended period. It needs ongoing caring, regular checkups, and continuous management. Without that, it gets worse. Before we could ask which patients were being lost, we needed to know which conditions actually count as chronic. The dataset gives us diagnosis code, thousands of them, but no label telling us which ones are chronic and which ones are not. So we use the chronic condition indicator from AHRQ, the Agency for Healthcare Research and Quality. It is a federally maintained classification tool that maps every ICD-10 diagnosis code to one answer, chronic or not chronic, 0 or 1. We match every diagnosis in the Storm and Vale hospital dataset against it. So when we say a chronic condition is chronic, we are not making judgment calls. We are using the same definition the US federal healthcare system uses. At first, we asked which chronic conditions are losing the most patients this way. Here is what stopped us. Our first instinct was to rank conditions by dropout rate, and the number looked small, as we can see from the visualization, around 8%. This might be small, but we're working on someone's life. Even one is important. We can also conclude this dataset contains nearly 300 chronic diagnoses. In healthcare, even a small rate across a large population represents an enormous number of real people. Dropout is not one department problem, it is everywhere. And who are these patients? We can see that 99% of chronic dropout patients are confirmed alive. From first glance, maybe we will think alive is a good sign. But in this case, after going out and never coming back, this patient is still out there with chronic diseases that needs caring. These are living people diagnosed at risk and completely off Stormonsville radar. The system did not lose them to death. It let them go and had no system to notice.
So we knew the scale. The next question was why? Our team's first guess was engagement. At first, maybe the patients did not understand how serious their condition was, but the data pointed somewhere else entirely. Dropout was concentrated in specific patients, and what those patients had in common was not a lack of understanding, it was a lack of resources. We looked at 4 economic hardship domains from Stormon's Vale Social Determinant Survey, which consists of food insecurity, housing stability, financial strain, and utilities. The gap between dropout and returning patients was not subtle. Dropout patients are up to 6.4 times more likely to report hardship across every single domain. These patients are not skipping appointments because they do not care. They're choosing between a follow-up visit and keeping the lights on. Survival won. But here's the part that matters most. Dropout does not mean these patients got better. Chronic conditions only get worse without care, and the data shows exactly where they end up. So economic struggles, indicated by zero index here, consist of 3.6% emergency admission rate, while for struggles includes 81.8%. Every step up is a patient whose condition worsened in the gap between their missed follow-up and their emergency room visit. We do not want these patients returning to Storm and Vale in crisis. We want them for returning in a routine appointment. The difference is tens of thousands of dollars, and for some of them, it is their life.
Okay, so by this point, we already knew who was being lost and why. So we looked at what Stormont File Health was actually doing about it, and then we found the data of Douglas County. Douglas County stands out immediately because of the 33% chronic dropout rate, more than double any other county, and we found out the reason why. So the average age of Douglas dropout patients is at 65 years old, and the number one diagnosis is chronic kidney disease. They came in for their first specialist visit, and most never came back. This is very dangerous since kidney disease without follow-up does not stay manageable. From the data, 95 to 99% of them are alive, and Stormont-File Health has zero social determinants of health survey data on them. No social risk profile, no record of their financial situation, their housing, or even their support systems. Stormont-File Health saw these patients, diagnosed them with a serious condition, and had no system to notice when they never came back. So our final question was, what does the highest risk dropout patient actually look like so that Stormont File Health knows who to prioritize? To do that, we already trained a random forest model to find out the feature importance, and you can see it on the left chart. The top three predictors are chronic disease, MyChart application activated, and age. And the thing is, Stormont File Health already has all of this information. Chronic diagnosis is in the record, MyChart status in the system, and age is known at registration. So Stormont File Health can easily identify the high-risk dropout patient. So our recommendation is very simple. We can flag them, screen them, and then call them within 30 days if no follow-up is booked. The cost of that system is just a phone call, and meanwhile, the cost of not having it is what this entire presentation has been showing you. So that's all from us, and thank you for listening.